Yeah, I got some bad habits, I admit it. I need to get my shit together, need to quit it. I get sick and tired of the way I'm living. But shit, I like just what I like, ain't nothing different.
But yeah, man, let's jump into it, man. This 365 Never in a Fight Help Talk, check your temp edition. Got my brother back on the screen, man. Amir, man. Say you feeling good today, brother?
Yeah, having a good day. You know how it is.
Gotta say that, up and down. Roller coaster.
Today's a good day.
Gotta say that. What you got on right there? I like that.
Oh, this a new design I came up with. It's called Rose Through Pain.
Yeah, so, that's slick right there. I like that. Yeah, gotta say that. So you got the hoodies out. I need to get mine. Get them hoodies printed up my damn self. Gotta say that. Yeah. But nah, man,
I was saying up here where we at, it get cold quick. So
do it. It's chilly up there already?
Nah, not yet. Okay. But I'm pushing them because we probably got about 4 weeks left of heat.
Okay, yeah. Murder after that is chilly willy, blowing down your neck. Gotta say that. Yeah, man. But real quick, man, I know last time we spoke, you was did a little stint in the hospital. Everything good with that? I see you done bounced back.
Yeah, I'm better now. It's like just feet swelling up, and they said it was they saw fluid in there, and they took like a piece of the bone to test the bone or whatever, but it kind of went down on its own.
Okay.
Man, it's like once you have sickle cell, everything is tied to that. Like it can't be nothing else. But I'm good now though.
That's all that matters. I gotta say that. I know what you mean. They tie everything up on the sickle cell. It could have been you ate too much salt. You know what I mean? It could have been all type of things. But I guess they crossing their T's, man, and dotting their I's. So I guess that's a good thing coming from the medical field. You know what I mean? But it's a question I want to ask, man. I know we touched on it briefly, man. But today, man, I just want to touch on, man, is how sickle cell influence your life, and in what way that you can think back from early stages all the way up to now. How did it influence your life?
It's been It's been the life. It's been everything from as a kid not being able to do certain things. Like all right, we going to the beach, or I remember going to camp with kids or whatever, and they heading straight to the pool, heading straight to the beach, and I'm sitting watching or whatever. Then that sun beaming down, they shoving water down your throat, like, so it wasn't even fun from like
right.
So it impacted every way, from school, being in and out, missing days of school, growing up, missing work. It's like every part of your life is affected.
So okay, so it's safe to say that your earlier struggles planted some seeds. Did those seeds sprout as you got older? Did it make you have like a complex as you get older, or do it make you reflect like maybe this where my anxiety may come from, this where my depression may come from, some things like that? I mean, did anything sprout that you noticed from all the early on hurdles?
Yeah, of course. Growing up, you get bitter. That you can't do certain things. You wonder, why am I not like the other kids?
Yeah.
And, when you're younger, especially when you start hearing, like, I don't know what age you heard it, but when you start hearing about people pass away from this, I mean, that hearing that as a kid, you like, all right, how long? Like, I had a girl in high school, she's like, why are your eyes yellow? I told her whatever. She was like, oh, so you're not going to live past 18. Just straight like that. That was exactly what she said.
No chaser, just straight.
No, just straight. Like, but she said it so like she was really concerned. But, you hearing that from young, you're like, all right, am I? You start wondering, like, how long do I have? start hearing it from doctors, like, oh, maybe this time.
Yeah. Yeah, man, it's deep because I can relate to that. Just how it influenced me, man. Same concept, really. I overheard. The crazy part about this is I overheard a doctor tell my mother I was standing outside the door at the age of 10, and they said I wouldn't live to be 30, even though I had my son. But when I came close to 30, oh man, even though I know God got the last say so, and even though we know this, but we human. You know what I mean? It's like, like maybe this guy, he know what he's talking about. And as I got older, I fear my 30th birthday. I mean, it was like, yes, I was a parent at 19. I had jobs. I did quite a few different things, but along that way, I had surgery on top of surgery, 2 metal hips, stroke, heart attack, lost my eyesight. But 30 come, and I'm like, I got my GED, went to college. It's like I started late. Because it was like, I told my son's mother, she was 16, I was 19. And I told her, I say, look, you need to get your stuff together because in my mind, I'm checking out. Like, I'm just living. Like, at this point, I'm just doing me. Like, but my son still kept me on a right path because don't nobody want to go to jail. So my son still kept me on the right path. But I felt like I was on borrowed time, basically. Like, you know what I mean? So I agree with that, man. I know that feeling as a hearing something like that as a child. And I think those seeds then sprouted in me now. Even though I knew this, I got, for the same concept. Not being able to go to camp or, can't do what other kids do and, being turned down, like, for military. I wanted to go to the military. Couldn't do that due to sickle cell. Losing jobs. What else you would say that that you deal with now mentally or trying to, from childhood? Like, how did you get beyond that?
I don't really know if I did yet. I mean, I still have those same fears and worries. Like, when you hit 40, it's like, all right, well, how much? How much time? Like those things play in your mind or whatever. Yeah. And it's like, you're looking at your kids like, all right, I just want to be around to at least see this. I just want to see this. I want to see them be able to do this. So those thoughts, you try to block them out or whatever, but they're always there.
Yeah. They creep back. They creep back in, man. I mean, I feel you 100% on that, man, because, I kind of knew the answer. You know what I mean? What you was going to say, because I feel the same. You know what I mean? Can't help but, still try to plan your life.
Right.
But it's almost like walking in quicksand. Like, even for example, this right here, when I reached out to you and said, man, let's do this podcast on such and such day, such a time, it's almost like I live in the now. Like, I live in the moments. Mine's is moments. Like, I was telling my therapist that the other day, man. I was telling her, it's weird to say it out loud. Yeah, I mean, you probably imagine what I'm about to say. It's almost like it's hard to dream about something so far away when you're fighting something right now that can possibly, go left. You see what I'm saying? So, but even though we do it subconsciously. We do it. We always planning, but it's almost hard to say it out loud. Like, oh yeah, next year I'm a B C D E F G. Like, this is more or less like, okay, next year we're gonna do this, and I'm gonna leave it at that. And if I be there, I'll be there. Like, what I mean? It's that type of situation. Like, but it's deep, man. Like, so what do you use to block that I don't want to call it, I guess it would be negative energy? Or is it, because it can't be, would it be negative? Would you call it negative energy?
Yeah, those negative thoughts or whatever.
Yeah.
I try to have more positive thoughts or whatever.
Yeah.
Like you say, even things like this. Like when you said it, let's do Wednesday or whatever. you know, you like you said, you live in the moment. First thing I'm thinking, like, all right, how am I going to be feeling at 3 o'clock on Wednesday? You know what I mean? Like it's crazy that you got to think like that, but it's like, all right, how am I going to actually feel at that time?
Yeah.
You know what I mean?
Yeah.
I'm not going to be able to. So now it's just, I guess, getting into this stuff. I think like we touched on before, like talking to people and staying busy.
Yeah.
Staying busy and not letting my mind wander and be idle.
Yeah.
You know, really like, and people, you know, just being, I want to say comforting or whatever, but just people reassuring you like, nah, man, we behind you. You good. Like you always been good. You know, you strong or whatever. It's just, you know, I use those things.
Yeah.
And then with kids it make it a little easier because they make it hard for you to kind of, I mean, I can't lay around and
Right.
and show them like, oh, I'm out of it, I'm this and that. Like, nah, I mean,
Yeah.
just looking at their faces, they can't, nah, they don't want to see that.
Nah, they don't understand. And which what I'm hearing you say is you pull from their energy and their expectations because you're still their father. You know what I mean?
Right.
And you want to be there and you want to be involved. You know, so you pull, and that's what I did with my son, man. My son was my energy. Like, I mean, I pulled, and even at my lowest of the low, you know, he knew how to assist me and just give me some water. Or he'd call himself trying to walk on my back and massage me with his little hand when he was younger. You know what I mean? When it got to that point, man. But, you know, but when it comes to the kids, man, you know, it's like you pull from the energy and your kids make you get up. They make you, even when you don't want to get up, you know, you like, oh, let me go do X, Y, and Z, man. And that's what I did, man. But just tell me, man, for us, I know we teased about it yesterday. I think it was yesterday or the other day, about the things that we hear from people when it comes to sickle cell. Like you just said earlier, somebody say, oh, are you going to die? Like, you know, you ain't going to let it be such and such. Like, what's the craziest assumption that you didn't heard from someone when you bring up sickle cell?
No, that probably was it. That probably was the craziest one because it stuck with me, you know, all of these years. That probably was the one. Like, oh, you know, you ain't gonna be around that long.
Yeah, gotta say that. Do you see a therapist?
No, and I was gonna ask you that. My wife was, you know, saying, oh, you should see a therapist or whatever, you know, to kind of talk it out. And my only thing, I was like, I don't want somebody that's going to give me like how can I say? I don't want like a cheerleader. You know what I'm saying? I don't want like well, you know, try this and do this and do that. Like, I'm 40. I done tried it all. You know what I mean? So that's what I was going to ask you. Like, how has therapy, like, I know you mentioned your therapist. How has it helped you?
Well, actually, I'm just now in it. My second visit. My first visit was hilarious, man. You know, as men, we try to be all like. And she asked me like, "So what's wrong?" So when she said that, I started booing. Oh man, it was like, because it was like the weight of it. It's like, you know what I mean? Because I mean, it's preach to the choir, but the weight of it, like when you open up about sickle cell to anybody, something that you protect every day, all day, and then when you speak about it to someone who might not understand or really don't care, you know, it make you kind of vulnerable. Like you in a vulnerable state when you speak about sickle cell because we keep it to ourselves so much because we protect it. But when I talked to my therapist, man, and she was like, and like I said, she just asked that question. And I'm a type of cat, I don't like to cry. When I do, I get mad. So I kind of like just shut up and I kind of turned away from the camera for a minute. But she was like, nah, don't do that. What is that? Like, she kept pulling me like, and I ain't never had that before. You know, I'm like, you know, I'm stubborn. I'm like, hold on, like, let me finish. Let me get my mind right before I can open up, man. But this is a new journey for me. For this therapy, I knew it was time for me to get therapy, to talk to somebody when it started affecting what I'm doing here in my everyday, because I kick myself if I'm not, let's say if I go a day and I don't do nothing, I punish myself mentally like, damn, I should have did this. I don't know how, but I don't know how to, and everybody else around me would say, oh man, you do a lot, man. To me, I feel like I can do more. You see what I'm saying? But my body, the narcotic, I'm nodding. I'm like, and I'm getting older. We getting older. Like, so it's worse. It's different when we was 20 taking a Percocet versus 42 taking a Percocet.
Yeah, it's different.
Night and day. Like, so, you know, when I got to that point of like kicking myself in the butt over and over again and feeling down and depressed because I felt like I didn't hit a mark. I mean, I should have did this, but I didn't. You see what I'm saying? Like, and I started feeling bad about it, man. Then just constantly thinking about the death and thinking about, you know, all that, everything that comes with sickle cell. So it's like, man, let me see who can I talk to get, you know, to organize some of these categories in my head, like, you know, to try to get some type of understanding, man. And it's early, man, but I will suggest us for, you know, anybody, Black people, period, man. I mean, besides sickle cell, we deal with mental health, you know, just what it is, just from history, you know, but we speaking strictly sickle cell, man. I think it would be beneficial, man, for you to tap into it, man. I really do, because, you know, just the fears that you still think about think about that, man. Somebody told that to you, what you say, 6th grade? Elementary?
Like 10th grade.
So yeah, it's just from school always, and it's still walking with you.
Yeah.
Like, cause same as me. Like, I mean, I think about death at least, man, all day. Off and on. Off and on. And when I get caught up in it, I grab my dog. I got a dog, he's a therapy dog. You see what I'm saying? So I grab his name Loyalty. He's a Boston Terrier. And I go grab him, I go for a walk, and I refocus again. Like, then I get back to it. Like, but the therapist, man, is early stages. I hope she's a good fit for me. But so far, so good, man. And, you know, I'm just going to document it, man, and just keep talking about it, man. You know, I think it's a good thing to talk about. And that's what this is, man. That's why, you know, you probably like, you know, I just met you, but I call you out the blue, like, what's up, bro? Like, you know what I mean? Because to talk to somebody who walking the same path is therapeutic by itself.
And that was another reason, like I was like, if I'm gonna talk to a therapist that don't know or never been through it, don't understand, what am I going, you know, what they gonna tell me? But you know, I told her I would try it. I would try it out, you know, find somebody just to get it out.
Yeah, I think it helped, man. I think I really do, man. And to piggyback off what you just said, my therapist, when I first sat with her, I asked her, I say, well, she, you know, because it's always a two-way interview when you meet with anybody. So I asked her, I say, so have you ever dealt with somebody with sickle cell chronic? You know, they always, I know somebody that died. Like, you could have saved the dad part. Like, I don't want to hear that shit. I mean, I'm trying to keep it clean. Y'all don't want to hear that part. Like, like, you know what I mean? But it's always, I know somebody that you know, but, and then I started wondering, like, can she help me? And then she was like, well, so I say, what type of therapy do you do? She said, well, I deal with childhood trauma that transfer into adulthood hurdles and things like that. So I'm started thinking, I said, well, I ain't got no childhood trauma. She said, well, actually, you do. She said, you have sickle cell. She said, you've been through a lot as a child. And that's what made me give her another chance. That's why I'm going to see it. I'm going to see, maybe by my 3rd, 4th visit, I know if she's right for me. But when she said that, it made me think, you know. So, you know, but that's her role. She you know, that's what she do, man. But I'm looking forward to finishing, you know, seeing what will come with that, man, and how it can help me. But I agree, man. Yeah, ain't nothing wrong with it, you know. I mean, you got to talk to somebody. I mean, you know. But I'm asking another question, man. What I know for me, I get exhausted when I hear people say you strong. How do you feel when people say you strong? What that mean? What you man?
Nah, it kind of it fuels me a little bit, because that lets me know that people are, I mean, the people that are genuine, you know, when I get it from genuine people that be like, man, like you know, then it fuels you a little bit, like, all right, I'm not, like you said earlier, you know, when you lay around, you feel lazy or whatever. Like, even in the hospital, I felt like it's another couple of days and I'm not doing nothing. You know what I mean? Legs swollen, I couldn't walk, but I'm still beating myself up because I'm down or whatever and not being able to produce.
Yeah.
So, you know, when people are like, nah, like, you know, get better. We'll still be here. You know what I mean? Like, take care of you, be strong. It helps. It helps a lot.
Yeah. And for me, man, it's crazy, man, because at times, once again, it's all about who said. That's the key. It's all about who said. So I agree 1,000% on that. Because sometimes I'm like, man, I'm tired of being strong. Like I don't want to. Like, you better yet, look, guess what? You can have all this strength. You want it, like, you know what I mean? Like, you can get it, like, because it's like, you know what I mean? Because it really gets to you, man. Sometimes when I hear that, sometimes, but you know, but once again, I see it's all about who said, and it lets you know that people watching you. You know what I mean? You know, the chosen ones. You know what I mean? That's watching you. You know, especially when it comes to support, man. Like, you know, like you just said, like you have somebody tell you, man, you get well, we got you, we gonna be here. And that feel good, man. Like, I mean, you know, that feel good when you know you have a support system like that help you when you down. Like, I mean, so but not to back paddle, but what do you do when you get to the point where you punish yourself for not being able to produce? Or you think you should have did something today, but you didn't? I mean, how do you get over that?
I put it into perspective. Like, you know, I try to look at it like, could I really have, you know, was I really just wasting the day, or was I really hurt or really down or whatever, or in pain? I mean, I try to not punish myself if I really couldn't, you know, get up and get out there or whatever. And then there are days, you know, where some days you are, you know, just lazy or whatever, and you just, you know, laying around. So I have to look at it like, all right, you know, those days when I feel like beating myself up, like, could I really have done it, or was I wasting time?
Yeah.
That usually helps.
Yeah. I mean, because you analyzed your day for real, and there's times where, you know, I need to do more of that, because sometimes I just be, you know, just like, damn, I could do, you know. But like I would tell anybody, man, the few kids that I do speak with now, I would tell them, man, if you down and you at a stagnant position, just always constantly think of your next power move. Like, you can mentally plan, you can jot down, you can write down your next steps and your next, and when you get back on your feet, then make that happen. You know, so that way, and that's what I try to do, man. Like, you know, a lot of people, you know, I just did a video about going at your pace, right? I went to Arizona years ago, and my metaphor for sickle cell is sickle cell in life. My metaphor for that is, imagine your goals at the top of Mount Everest, and you got 1,000-pound book bag on your back. How many times you gonna stop before you get to your goal at the top? You know what I mean? And I found myself living my metaphor, man. 2 years ago, when I went to go visit my son in Arizona, he took me hiking. You know, and he know what I deal with. But if you look at me, people think, oh, ain't nothing wrong with that cat. You know what I mean? But see, so long story short, I'm going up the mountain. I made it. I already know it was halfway, but I was beat. I was done. Like, it was over. Like, so I told he like, come on, daddy. My girl was like, come on, man over matter, and that kind of irks me sometimes when people say man over matter. Like, that pisses me off. Like, you know what I mean? So like I try to tell them, so I told my son, I sat down, I'm in the dirt, I got an inhaler in one hand, a bottle of water in the other hand, but I got a smile on my face. Right? And that's, you see, a lot of people would, you know, which you can relate, dealing with a crowd. We walk around with this mask on, you know, we walk around with this mask, especially if we in public. So we got this mask on that people can perceive that everything is copacetic. But I sat down, I was done. I told my son, I said, I'm gonna tell you something, 3 things gonna happen if I keep going. You're gonna have to carry me out, they're gonna have to fly me out, but right now I can walk out. I say, so I'm done. So the whole time walking down the mountain, man, you know, I'm hearing them go have a conversation. You know, sometimes, you know, my son was having a conversation in front of me, and I hear them. And not saying they was coming from an ill will place, but they was judging me on their physical abilities. You see what I'm saying? But I know my physical abilities. You know, they don't see this 1,000-pound book bag on my back. You see what even though they know I deal with sickle cell, but they don't know what that really consists of. You know, you see what I'm saying? So the point of the story is we have to be comfortable with going at our own pace. We cannot judge our pace by the next man's pace, because all that's going to do is cause depression, anxiety. Why? How come I'm not there yet? You know, how come I'm not at that level yet? Because like I said, we deal with something a little differently. You know, like I said, if people ain't put on your shoes, they don't know how tight them motherfuckers, them shoes fit. You see what I'm saying? But yeah, I just did that video, man. Like, you know, what's your metaphor for sickle cell in life and for you?
No, I just went through that. Like we went to the beach, family day or whatever.
Yeah.
And the car, you know, the cart's is heavy, you got all the stuff. But then when you start dragging that thing through the sand, it's like, you know, that's a workout or whatever. Yeah. So, but I'm with all women and the kids or whatever. Yeah. So mentally, I'm like, I can't have them pulling this stuff. I can't be looking like this or whatever. But I had to tell myself, like, listen, I'll pull it. But when I stop, I stop. Y'all can keep going. I'm going to catch up or whatever.
Yeah.
It's like you said, if I keep going, if I push it past a limit that I know I can't go, it's my pushing it is going to end up in the hospital. You're pushing it is just, you're going to be sore in the morning.
Yeah.
You know, that's so I had to get over the, you know, try not to be embarrassed or whatever, because it's women or whatever. And just tell them like, listen, I gotta protect myself first.
Yeah. Yeah.
And to be able to leave here, you know, where everybody happy and having a fun day.
Right. Without having to go to I keep about to cuss, let me calm down, but having to go to the hospital, like, you know, and I get it, but they don't understand what that energy do, man. I know what you mean, man. There's times where my girl had to carry you know, a bag or something heavy, and you know, and people looking at me like this big dude, and like, you know, perception is, you know, on the outside looking in, you know, it's always gonna look crazy, you know. So, you know, but yeah, that's powerful. They never know that, you know, like that's real, man. But like, that's why I tell people you have to be comfortable at your pace, be okay with it. And sometimes, man, our loved ones don't even realize what they do, you know, they try to encourage you, but they making you feel worse. You know what I mean? Because they trying to, come on, you can do it. Oh, come on, ain't that serious? And, you know, you like, and then you don't want to say, man, you don't want to bring sickle cell up. Like you shouldn't have to bring that, man, you know, I got sick. You know what I mean? That right there, that would make me seriously mad if I get to that level. You know, so sometimes I just shut up and just push on, like, you know, because I don't want to go there, you know, but it's deep, man. But a lot of us, man, you know, can really, you know, do us no justice if we compare ourselves to the next person, man. Like, I mean, it's good that you know your limits, man. And a lot of us should know our limits, man, and be okay with our limits, man, and you know, and be cool, man. Like, I mean, but like I said, man. So tell me, you know, I know we spoke about it recently. You were saying how people, you know, for example, for me, I know when I was younger, when people started finding out I had sickle cell, they thought it was contagious. They thought, you know, you can catch it, and you know what I mean, different things like that. How that make you feel when you hear the stereotypes when it comes to sickle cell?
Oh yeah, you get pissed, man, because people they just ignorant. Like I'd rather you just ask me. Just come out, you know, ask me like, well, you know, what is it? You know, like, but don't show the fake concern or whatever. You know, that's when it gets weird. You know, that's why I posted the video about you know, things people say or whatever, because it's the fake concern. They're like, oh yeah, I know somebody, like, yeah, but
they
if you
care
really
less.
knew somebody, you wouldn't be saying the stuff you're saying.
Right. So, yeah, they really could care less, man. Yeah, I mean, you know, how old was you when you want to become an advocate? Like, what age did you protect you having sickle cell when you was younger? Like, when I mean, to the point where you didn't share it, you didn't nobody know except your close ones. I mean, how old was you when you got to the point where you was like, you know what, let me start talking about this? to certain people.
Really, this year, really this year, and starting to, looking things to better my health and things that I can do on my own, trying to let people know, things that they can do. Before that, I was a barber for years, and half the customers, like, we didn't even know. It was like, there was one EMT, he was like, I know there had to be times where you was, in pain or whatever, cutting my hair, because I know, I'm in that field, so I know what it is.
Mm-hmm.
But, you never displayed it or whatever. So,
yeah.
And as a kid, you don't want the jokes, you don't want the questions.
Yeah.
Really, I mean, half the adults really don't care. But as a kid, they really don't care.
Nah, they cruel.
Right.
They cruel. Yeah, they real cruel. Right. Yeah. I just got to the level.
All kind of jokes about you got this and you got that and you. So now, only close friends know, and then they would be actually be more of advocates, like chill out, with the jokes or whatever, because he's dealing with it. Yeah,
I had a few partners, man, that went to blows on my behalf when I was younger, for that reason, man. And what made me stop bringing it up when it got thrown back in my face, when if I hit you, I kill you, things like that. After that, I kind of kept it on the low, and we already know we grew up in a certain part of a town, certain part of a hood, what this can be perceived as weak, and anything that could be perceived as weak gonna get exploited. You know what I mean? So I kept it on the low, man. I remember back in the day, my Dr. Rutnagel, and he was like, "Well, D'Angelo, you can't fight everybody to say something about it. They ignorant. You have to educate them." And I wasn't in a period of, it's like 2021. I wasn't in a phase of my life to where I wanted to speak about sickle cell. Like I didn't want to, I just started probably maybe 2006 when I almost died. I had pneumonia in both my lungs. I had pneumonia in both my lungs, and I prayed, I prayed to God. I'm like, if I get up out of here, man, you put me through this one, I'm gonna be an advocate from here on out. And I've been doing it ever since, man. It's 2006, man. And I started off working at Hawksworth Blood Center, working for them. Now I still do blood drives. I'm no longer there. I lost a lot of jobs dealing with sickle cell, man. And just to piggyback off what you were saying earlier, the topic for us, how sickle cell affects your life. Me being fired, man, it made me feel a certain way, because when you're a man, you are the provider in your home, right? You looked at as, supposed to be a provider. And when you really can't hold down a job, man, it really can mess up your self-esteem. It can mess up your certain relationships, with certain, because sometimes women like men of power and power position.
Yeah.
If you're not getting up going to work every day, even though your safe ain't empty, or even though your bank account ain't empty, but if you're not getting up every day going to work, you could be looked at as, less than.
Yeah. Lazy.
Yeah, you're lazy. You're this, you're that. So I think that's some of the seeds that have been planted in my head, and this is why I think I promote healthy relationships. You really got to pick the right one if you can. And if you end up, and if the one you pick shows to be the wrong one, leave, because it's not going to do you any good mentally. All the ill, all the back and forth, man. Like, how long you and your wife been together? You don't mind me asking?
We've been together about 4 years. We've been married a year and a half now.
That's what's up. But that just
I've known her since 10th grade.
So yeah, that's beautiful. So she knows. Did she know what you dealt with sickle cell back in the day?
Yeah.
Okay, so that's good. That's good, man.
That's really, around that age when friends start, close friends start, standing up for you, like you said, and they would, if they smoking, they like, yo, you don't smoke around him. Like I don't want nothing happening. I ain't taking him to the hospital. Like we about
to, right. Yeah, that's real,
It was
man.
more like, very protective or whatever. So
Yeah, that's what's up, man. But that's why I encourage folks, man, when they deal with relationships, man. I got a topic. I got some. Probably can't see this board. Now it look white. It look all blurry to me. But in the back, I got some topics that I'm. Matter of fact, I'm gonna ask you a few of them. You know. Uh, okay, let's talk about the drugs then a little bit. Then for the drugs. So, do you smoke marijuana? Weed?
no, I tried it, and my wife was like, "You're not even inhaling." I don't know if I did it right or what, but everybody's like, you should try it. It'll help or whatever.
Yeah.
But I tried it once. It's just the smoke part for me. Like
But
if I could get it without the smoke, because I already have trouble breathing. So
yeah.
it's just that part.
I was going, the ad lib on that, man. The edibles. I think the edibles, like I said, because smoking sickle cell is not a good mix anyway. Because it's all about oxygen anyway. I smoke weed. I smoke more for the medical part now versus when I was younger. I only versus taking all the narcotics. I take Oxycontin, Percocets. So I had to bring the marijuana back into the regimen so I can take less narcotic. Because that's one thing it do for bad for me. And that's a good thing, But if I was to, suggest anything, I would get the edibles. They got edibles. They got tinctures, like the little droplets and things like that. Are you familiar with CBD?
Yeah.
Did you mess with it? You tried them? Do you put that in your regimen?
No, somebody was supposed to. I guess he had one. He wanted me to try whatever, but I haven't tried it yet.
Yeah, when you get a chance, try that, man. That's good for anxiety. It's good for depression. It's good for pain. For pain, you gotta take a nice dose for pain, though. But if that's one of them days when you're in one of them moods mentally and you're in your head, it's good for that because what it relaxes you. You know what I mean? It's a healthier form. It's no THC. It's not gonna give you a body high or a head high like weed would. But for the marijuana, though, I think that'll be good too, man. Just do the edibles, though. Just be careful with the edibles. You can really. I had a bad experience on the edible, man. I thought I had a stroke. I couldn't talk for about 3 days, man. I'm like, you know what I mean? But
that's the thing. I've had an edible before, and I was like, "Oh, this it?" I was like, I don't know if it wasn't enough or whatever, but I was like,
"You got no experience."
Yeah.
Yeah, you feel nothing. Yeah.
Yeah, I ain't feel nothing.
Yeah, you might have to try, man. Like, are you able to get I know you can get it, but like a medical, the weed card, the medical marijuana card. I know I got one. If you get, I don't know if you get a chance, you get one, man. That way you can go in there and they can sit you down and talk to you about the type of marijuana, what it's for, the strength, and everything like that. Which I think is a good thing versus buying off the street. Because these days you don't know what you're getting. But yeah, I think for that, man, you should try that, man. I think it'll work out, real good, man. And I know another topic I got up here for is sex. When it comes to sex, I remember when I was in my marriage, and I've been with her for 18 years. My body started to change when it came to, it started changing around about 28, about 30, 31, somewhere in there where things, too much narcotics. I was on Oxycontin 80s, Percocet 30s, and I thought I had low testosterone, right? And because it was times where, things wouldn't respond in the way they used to respond in my 20s. So, which made my wife at the time feel a certain way, right? It's almost like, damn, I don't get no credit on how I used to respond in my 20s. How I used to get down now.
What have you done lately?
Yeah, what have you done for me lately type situation. So I went to I found myself watching Golden Girls and busting out crying over stupid things. I'm like, what's going on? Like, man, I went to the hospital, man. My testosterone doctor went to see her. They did a test. They say, well, it's not your testosterone. They say, well, then you're depressed. like depressed. She was like, how long? She said, how long you been on Oxycontins? I said, I've been on Oxycontins for a long time. And what Oxycontins did, it put my body to sleep. So my body wouldn't respond. It took a lot for it to respond. So that's why, I mean, you ever had some weird side effects from the narcotics that you take in that area?
Definitely. Yeah, no, not in that. I think more so it could have been tied to, definitely making you depressed or whatever.
Yeah.
So when I'm in that state, it's like you don't even have the drive or the will to, to want to do anything or whatever.
Yeah.
It's like, like forget about even, trying to get to responding part. It's to even getting to, do I even want to be touched? Like, like it just, but yeah, like certain narcotics now or whatever, you take them and like it starts to slow down. Like I can physically feel it like slowing down my digestion or whatever.
Mm-hmm.
And, especially with the constipation, it gets bad with that.
Yeah.
So that was definitely, one of the reasons why I wanted to try the marijuana instead, because it definitely does some damage over time.
Yeah, man. Like, because I'm gonna tell you, when they pulled me off the oxys, man, back in the day, it was a blessing in disguise. But I went through a withdrawal. I don't know if you ever experienced a withdrawal.
Oh yeah,
bro. I was in Kroger's with a cart, shaking this. I'm shaking, sweating. I'm jittery. I'm like,
sneezing, like just everything. It's like your body's like smacking the hell out of you for not giving it what it wants.
Yeah, exactly what it's doing.
Your body is attacking you.
Yeah, and that's deep, man.
Yeah, you can't sleep, you can't eat. Like everything is just, that's the worst. Which is why people don't stop or don't come off that stuff. They're like, man, I ain't that feeling.
Yeah,
like it's I would say for anybody trying to, or feeling like they're addicted to those medicines or whatever, the first part is definitely physical. You're definitely gonna have all those physical effects coming off of that, but everything after that is mental.
Yeah.
You know what I mean? It's mental, kind of like I need it. But once you get past that physical, then it's more so like, I'm good. I could do this. It's been this many days, or this many. It's been a month. It's been
at
that point, you just gotta,
Yeah, I agree, man. I'm gonna tell you something. I pride myself on where I'm at now in life, with prescription wise, and how I've managed my pain crisis now, man. Because I know where I came from, man. Like I was taking a lot, man. Like it was like I said, any kind of idle time, you can find anything wrong with you, and then you realizing that you are legally prescribed one of the most potent narcotics up under the sun. And you not realize every time you popping these things, you taking them, you really doing your body, man, damage, man. Because it's times where I was sitting to my class, these classes at the hospital, and my med peds doctor, she would call me in, D'Angelo, well, almost you come talk to a few patients sitting in with the pharmacy, but the pharmacist was sitting there and talk to us too, let us know, ask about our medicine. And I hear some of the patients brag, oh man, my Oxycontin, man, it's the best thing, man. It works for me and A, B, C, D. And I'm thinking to myself, like, but you got an oxygen tank.
Yeah.
Pulling it with you, and you only 30. Like, and I can't knock her because she was a great friend of mine, still is to this day, but I was able to give her my advice because they looked at me like I had the Holy Grail. No, it took me years, and I'm not anything about being perfect. It's not a such thing. But it's like, it's just, I put elderberry in place. I put a lot of magnesium, folic acid, different herbs and roots and in place to try to substitute. It's not about coming off the narcotic. It's about minimizing how much you take.
Yeah.
Because you would never come off. You know what I mean?
As far as pain, it attacks that pain. Like, and anybody in that much pain, you're going to reach for it. You know what I mean? But since I've been doing this, I follow a lot of sickle cell pages, a lot of patients, a lot of people. And like you said, I'll be watching them and they making videos and I'm cringing, because people are like, they're posting the amount of pills they take. And I'm like, man. And then like, there's people that's posting, their cells in the hospital. And it's like every 2 or 3 weeks. And, they're posting like, my nurses don't come. And I'm like, man, I know what that life is. I know what that's about.
Yeah.
I know what all that's about. And I live that. I've been there.
Yeah.
It's like, that's a bad place. It's a bad place.
It is, man. It's times, man. I've been in the hospital, man, and I had to turn away medication. They look at me like I'm crazy, and I tell them I don't need no more. I'm good. Like,
still.
They like, you sure? Like, they be ready too. Like Jason,
Yeah. I think, like you said last time, I've had times where I woke up in pain and pressed the button, and they're like, "Oh, I just gave it to you." I was like, "Nah, I just woke up. How you give me anything? I was asleep."
Yeah.
So they're like ready. They're like ready. A doctor, you tell a doctor like, well, I don't need to, you don't have to write for that many. I'm back. Oh, you sure? You sure? I'm like, man, like it's they passing that stuff out like it's candy.
They turned us into walking dope fiends, man. Like, like I said, man, I know when I first went, like I said, that withdrawal, and I was telling my doctor, I said, man, I'm a dope fiend. She said, no, D'Angelo. You're not a dope fiend. You live off. You need this to be productive out your day, and you need this to heal up at night. I said, but at the same time, I'm like, I'm going through withdrawal. I'm shaking. I'm jittery, and I don't want to. I hate that I'm dependent on somebody to look after my health. I hate that I'm dependent that I got to take a narcotic. Like, that's the worst thing in the world. Like, so I pride myself, man. But like I said, it's dangerous. A lot of them doctors, man, they really turn us out, man. They really turn us out, man.
And then the stigma comes where they're like, "Oh, you guys are frequent flyers or addicts, or you in here looking for this medicine." And it's like, well, what? There was no disclaimer when you first started prescribing this stuff.
Yeah.
And I spoke with a nurse recently. She was like, "What things would you want to see change or whatever?" And I was like, that's one of them. Just from the door, there should be, listen, this stuff I'm writing for you is strong, and I need you to take it like this, like I prescribe. You know what I mean? But take it as a last resort.
Yes.
Don't, you know what I mean? Don't, because you don't, and they need to tell you that you don't want to be dependent on this. Try everything else. Like, I'm writing for you, but try other things.
Yeah. Yeah.
It's backwards. It's like, here you go. Here's 1,000 pills, for the month. Here you go. Take them and, you know what I mean? But don't get hooked. You know what I'm saying? Like what?
I'm going to tell you some funny, man. I'm going to tell you something, right? Because now, I'm sure they probably do it up there too, where you at, man. Now they do this 90-day supply thing, right? So they try to tell me, well, D'Angelo, we want to give you 90 days. I say, no, I can't. I don't want 90 days worth of pills in my possession. I say, because not saying I will abuse abuse it. I said, I know how to manage when I come every 15 days and only get 90 pills. Like, I don't want that times, 90 days worth for that. Because I know what I'm taking. I know how much I'm taking. So I don't, So they were like, you sure? Do you want to keep coming back? I said, I don't mind coming back up here. Don't give me that much medicine at one time. I don't trust myself. Like, but they'll try to shove it on you, man. And, but then when you turn them down, they look at you, crazy, or they look at you as if you don't need it. Right. Oh, ain't nothing wrong. You cool. No, I still need what I need. I just got my regimen and I got, my process. You see what I'm saying? But don't, don't knock me, man. But like I tell the people, man, I don't want no young patient, man, to be a full-time patient. A full-time patient when you constantly run into the ER for every nick and cranny, you constantly, because one, you become a hard stick. There's only so many things you got in your body before you got to do ports, and you look at like this, malpractice, and then you got a clot, and like I said, so I don't want to see these young patients, man, come up, man, just run to the ER thinking they know the way, and the reality of it is they don't even really know, like, let alone care. You know what I mean? You know.
It's a lot of them. Like I said, I see a lot of them posting these videos, or I'm in the ER, and listen, if I'm in the ER and I'm bad, they ain't no picking up my phone, man. There's no recording, none of this. When you at that pain level where you telling a nurse, oh, I'm at a 9 or I'm a 10, but you on your phone recording, and it's like
sitting still.
Like yeah, sitting still. Because at 9 or 10, no, I'm on the floor.
I'm pacing.
Right. I'm pacing. You know what I mean? And we know that level of pain or whatever. So
Yeah.
I just want us, as a community to start being real with, when it's at that 10, be at a 10. But if it's not, in that stigma, we're not looked at crazy and, as drug seekers.
Yeah, you're right, man. You know what I mean? I know I asked you before, man. I'm gonna ask you again, though. What's the longest you ever waited in the ER? Before they go back.
It's probably been a good 8 hours.
Yeah.
A good 8 hours.
Yeah. So what games, what lessons you learned to help? You know about this, so I'm trying to word it right. What tactics, what lessons you learned to help push you up the line to get you back there faster?
Yeah, the main thing, I would just go at like 1 or 2 in the morning when I know that's the slowest time. It's like, if I can hold it out, I can wait, throughout the day, then I'll go. But now, like I said, lately, it depends on who you're. Like if you're what they call a frequent flyer, they'll make you wait. They'll make you wait because they already feel like you faking or whatever.
Yeah.
So now if I'm there, they probably haven't seen me in years, you know what I mean, or months. And if I'm there, it's bad. You know what I mean? I'm, you all over the structure, all over the bed, all over the chair. So usually that, will get you in faster or whatever.
Yeah.
But those times you're talking about, especially if you just been there, you're there once every couple of weeks, but you walking in on your own and you sitting in the chair and you doing all of this, they like, all right, well, you in the back of the line with everybody else.
Yeah, because they watching you. They don't understand that they watching you. They watching you. You best believe they sizing you up. And this is you know what I mean? Because each time, like you said, I have waited at least 8 hours, in the ER before. And I don't know the point system that they use where you from, but we're here in Cincinnati, they have a point system to where 1 is severe and 5 is, you can sit out there for 10 days if you ain't go home, take some Tylenol, they bring type situation, like but like I said, which and it all depends on who's there and what mood they're in.
Yeah,
that's what I hate about this sickle cell. It's all we are at somebody else's judgment, disposal, and whatever mood they in can affect what you got going on. And you could be sitting out there, throwing up, just always short of breath, different things like that, man. So this is what I tell people, man. I tell the young folks, man, you just try not to be a full-time patient. And what you said, man, make that narcotic your last resort. You know what I mean? Because like I said, at the end of the day, the more you take, the more your body get used to it. And most likely you addicted to it. To all honesty, I know we probably don't like to say that, you know what I mean? But, at least make sure you're taking it for the right reasons, man. Like I said, man, because it's a hell of a game, man. And one more question for you, man. Give me a experience you had in the ER dealing with, that's what I'm looking for, unexperienced nurse. I'm going with us. You're like, I mean, how as a man of 40, how old are you? 42, 43?
41.
41. As a 41-year-old man, you are able to tell when somebody is seasoned in the ER. Give me a story where, a situation where you was able to find out, like, now something going on with this doctor / nurse. Like,
but the ones that really start, taking their time, they're taking their time with with everything. You know, just taking their sweet time. The doctor done wrote the orders an hour ago. You know, they still pacing back and forth.
Yeah.
And that's what I said, like having a good doctor is good. Cause you know, if I had one doctor, I let him know, like, listen, this nurse is not it. You know what I'm saying?
Yeah.
Or I've had nurses go against the doctor's orders. Like they'll write an order and then they're like, well, I'm gonna give you half now and half in like they've actually like, cause this is too much. Which is now, I tell everybody, if you're going in there, you have an advocate.
Yes.
If you're going in there and you know, you're in a lot of pain, you better have an advocate with you, because then they start to move. They start, everybody want to come over and talk to you now. We sorry.
Yeah.
Oh, matter of fact, just, it's crazy that you asked that. Just this last one.
Yeah.
I went into, I wouldn't say it was a surgery. It was a quick procedure where they had to, you know, cut the foot open or whatever, cut it open where it was fluid, drain it, test the bone or whatever. So the foot was already hurting before I went in. I came out and I woke up and it was like, the pain was times 10. But the nurses, I'm telling her like, yo, like this thing's hurting bad. Like, you know, can you take me back upstairs? Can you, you know, get somebody to take me upstairs? Cause this, you know, y'all don't have what I need down here. Y'all don't, you know, like me sitting here in recovery, I'm not doing that.
Oh yeah, yeah.
So she's like, well, let me just take your blood pressure. I'm like, all right. She come back over 10 minutes later, let me take another one. And she's taking temperatures. I'm like, listen, just call somebody. She's still like nixing me off.
Yeah.
And I'm like, I was like, well, can I have the phone so I can call my wife? Because she was upstairs. And I'm like, if she come down here, it's a wrap for everybody.
Right. Right.
No, I can't give you the phone right now. That's when I went off. I went off. Like,
that's
everybody at the hospital know, man, I'm nice. I'm the nicest person, but she was just like, she didn't care about, you know, how bad it hurt or whatever. She was just like, you need to calm down. That's the last thing. That's the last thing to tell somebody in that much pain is calm down.
Yeah. Yeah. That lets you know that she don't know, man. She don't. This is why I say, man, I hate to be at their disposal, man, because, you know, you get the wrong one that would size you up and, you know, make you make like they know what they know best. Like, you know, it's like, you know, so it's, you know, it really frustrates you, man. It's times where I had the same thing, man. It's times where I was in there with pneumonia. And this years ago, this back when I used to smoke weed out of cigarillos. And then, like you said, for smoking, and I feel like that's why I kept catching pneumonia from. But I'm in the hospital with pneumonia, sitting in there. And in fact, I was eating a hamburger. This doctor, young doctor, had to been about, he was young. I was probably older than him, or the same age as him at the time. But he about to send me home. Like, oh, you know, with him, he's good, he's eating. So it was a nurse who know me. She was like, well, Denzel don't come through here like that. Like, she was like, he don't come through the emergency room unless something's really going on with him. Man, they did a test, found out I had pneumonia. I said, you about to send me home. You judge me because, one, I'm not crying.
Right.
Now, at this point in my life, I know how to maintain. Yeah, I'm not crying. I'm not, you know, fussing. So they judging me as if, he's all right. You know, so I had a situation with the doctor. They almost sent me home, man. After the test, but I had pneumonia. Man, I was in the hospital for a whole week, man. You know, and like I said, I'd had nurses. I had one nurse, man. Just recently, I was in, it was like a month ago now. Went to a hospital here, Mercy. So I'm in the ER. You know, they take me back, and I'm a hard stick now. So they have to bring the ultrasound machine, bring it out so they can find the vein up under the skin. So I tell them where to stick. I say, well, I'm a hard, she all up here. And I say, I ain't been stuck in this since I was a child. Like, that's the first vein to go. Like, you know, right here in the vein. That's the first vein. So I say, well, if you're gonna get anything, you're gonna get it in my hand, and you need to use a lower gauge needle. Preferably the green one. The green one is the smallest one. I think it's a 20 gauge, or even a butterfly.
Right.
Oh nah, man. Yeah, she's like, oh nah, I got it. And she doing this, but she all up here, man. They stuck me. 7 times. And I'm looking at her. So one time, so this lady, so now they finally bring in the ultrasound. She look at, I could tell she don't know what she's doing, watching her like a hawk. So I could tell she don't know, she got an idea. So I say, how many ultrasounds you do a day? Well, I do them, and I do them when they need me to do them. I said, okay, it was a vague answer. Man, she went in there looking at the screen, went in there, and when you do an ultrasound, they go so slow you can hear your skin break. They went in, man, she hit a nerve. I don't know what it was. My whole hand did like this. Like it closed up. So I cuss her out. I let her have it now. Like, I'm cussing her out. Like, she looking back all red. Like, I say, no, I get somebody who know what they doing. I ain't got time for you to be playing with me or trying out some things with me. You see what I'm saying? But, just the older we get, man, we know we don't have the time for no student. Because you see hospital here where I'm at, it's a learning hospital. So a lot of the kids that graduate from UC come through there and they won't let them try to access you. Yeah. And sometimes when you're in that much pain, you don't have time to be dealing with a rookie. You need somebody that's gonna get in there, access you, get this fluid going, get this medicine in, and then I'm all right. Then we can talk. So I done had all kind of situations, man, dealing with rookies, man, and a whole bunch of disrespectful things, man. One more thing, man. Do you take when you in the hospital, do they give you a lot of fluids?
Usually like lately, I've been like I'll swell up from the amount of salt that's in the IV. So they don't do it as much. I just try to drink, a lot of water on my own.
Yeah.
But it'll be fine for like the first day or two, and then after a while, the amount of salt that's going in.
Yeah.
Which I never understood, why salt is in it anyway. I don't know what, I'm gonna have to ask about that one, but I've always thought it was just straight, water hydrating you or whatever. But
yeah,
it's a lot of salt in there.
I'm gonna tell you the backslab on that. You get a chance, man. Look it up. I don't know if I told you last time we spoke, but I learned from my doctor years ago. She was like, "Well, D'Angelo, when you in there, try to drink as much water as you can." She said because too many saline IV bags can cause heart failure. So so every time I go in there, I would tell them to drip it slow enough to get my pain medicine through, then cap it. Then cap it off because I could drink water on my own. So, but I will tell anybody that, man, like try not to use them bags because they, for some reason, that's something they learned in school, to hang all these bags and give you all this salt water, saline, but it's bad for your heart. And as you can see, it make you swell.
Yeah, I never understood. Like, I'm finding out everything they doing to seem to be counterproductive to your actual health.
Yeah, exactly what it is. That's how I know a lot of them don't even really be knowing. Don't get it twisted. And if I'm dehydrated, and that's a different beast. And if I'm at the point where I can't pick up a cup and drink myself, then that's a different beast. But if I'm able to pick up a cup, bring me a cup. Don't hang this bag. And I tell them all the time. And when you drip it slow to the slowest part how you can drip it. And that right there is enough to get my pain meds through. You know what I mean? So, but like I said, man, I ain't we ain't gonna stay here too long, man. You know what I mean? I always enjoy the conversation with you, brother. You got anything you want to tell leave on here? You got anything you want to say? Last minutes.
Yeah, man. Still trying to get this certification for this, nonprofit started. So we can help a few folks out, that's in the hospital missing out bills and things, and just missing out on life.
Yeah.
I can help a few people. They can check out the website, tillwefindacure.com.
Okay.
Yeah, that's pretty much it, man. Everything is on the website. So,
man, it's 365 N.E.F. Health Talk. Let's check your temp edition. We just checked the temp of my partner Amir. In other words, we're saying how you doing. Once again, we are on the verge of raising $20,000, which is $1 a person. If you don't want to do the whole donation, but that donation would allow us to bring our services to the doorstep of the kids. Once again, if you ever see a 365 Never Ending Fight fundraiser, support it. Come participate. We just did a school drive 3 weeks ago. So our adult fundraisers allow us to do free events for the kids. So once again, man, this 365 Never Ending Fight Health Talk.
Yeah, I
Y'all
got
be
some
easy.
bad
Come
habits,
here,
I
brother.
admit
When we
it.
get
I
off here, I'm
need
gonna give
to
you a
get
call
my
on the
shit
back end. You know
together,
how we
need
do
to
it.
quit it. I get sick and
All
All right,
tired
brother.
of
You
the
be
way
easy.
I'm
Take care, man.
living. But shit, I like
right.
just
I'm
what
up
I
right
like,
now.
ain't nothing different.